Hello, how are you doing today? This is Dr. Rueda at Precision Plastic Surgery, and we're here to talk about saline versus silicone. Silicone versus saline. What are the differences, pluses and minuses? So number one, just know that whatever choice you make, both are safe. If you go with silicone or you go with saline, you're gonna do a good choice. It's all about you and your individual decisions for your body. Let's start with saline. So saline has several pluses that I like to consider or talk to patients about. Number one, because it's a saline-filled implant, it can actually collapse. So you're gonna have it inserted, you can have a smaller incision, which is a great advantage. Second advantage of saline is that although ruptures are rare, both for silicone and saline, if there were to be a hypothetical rupture in a saline implant, it's very easy to detect because it's just saline and it just gets absorbed quickly into the body. Now, how about the minuses of saline implants? The minuses of saline implants tend to be more about palpability. So saline implants tend to have an effect called rippling, where there can be a scalloping appearance to the lateral side of the breast or the top side of the breast. So women don't like that, and it's one of the minuses of saline implants. A second minus is also the feel. Saline implants are filled with saline. It's like being filled almost with water. So when you palpate them, there's more of that tough feel or lack of compressibility when you feel it. It feels less like breast tissue, basically. So that is the two minuses of saline that I usually try to explain to patients. Lately, in the last years, there's been advantages and advances, like the ideal implants would actually help resolve some of the palpability issues. But if I were to categorize the pluses and minuses of saline implants, then those would be the two things to keep in mind for them. All right, let's talk about silicone implants now. So we're going to talk about the pluses and minuses of silicone implants, or pros and cons. So let's start with the pros of silicone. Know that silicone implants are actually the most used implants in the market. They still are the most common. And even if you choose saline, the saline implants are still surrounded by a shell of silicone. So everything silicone is just the filling inside. Now, one advantage of the silicone implants has to do with feel. It feels more like the natural breast, and that's something that women actually like significantly. A second advantage that I talk to patients about silicone implants is that there's less risk of rippling and that scalloping that we talked about that can happen a little bit more commonly with saline implants on the side of the breast, specifically with women that have thinner tissue on the side. The other advantage of silicone is, although ruptures are also rare, just like saline, they're rare, the fact that they're so rare makes it ideal for some women because they're like, okay, less chance of ruptures than saline. So that's an advantage that women also like to take home and think about, and usually end up sometimes choosing the procedure just based on that. And then a disadvantage that I would say about silicone is that if a rupture does happen, and that rare occurrence that does happen, it's a little bit harder to diagnose. So there's symptoms, there's exam findings that key us plastic surgeons into knowing that this has occurred, but it's less easy to diagnose than saline, where the implant just deflates and it's just quite obvious. So I think those are the global pros, cons, or pluses and minuses of each implant. And again, it's just your personal decision. There's no correct answer. It's all about the woman's decision of what they feel comfortable with. And in the most recent years, there have been advances in both types of implants to reduce all those risks. So whatever you choose, we're happy to see you here. We're happy to talk about them in person, but those are the general ideas that you should have in your mind before you come for a consultation. So it's good to see you all, and tune in for the next videos.